this. So if you would like to view it at a later time, or if someone else would like to see it, we will have that link posted on our website and sent out via email later as well. So welcome. We're going to tell you a little bit about the Colorado Sexual Health Initiative and what we do and what some opportunities are to partner with us moving forward. So, all right, so Colorado Sexual Health Initiative is a program which is now part of the Office of Children, Youth, and Families as of July 1st of this year. We received federal funding through a Personal Responsibility Education Program grant, which is State Prep. There's a few different funding lines. There's State Prep, Competitive Prep, Tribal Prep, and the Personal Responsibility Education Innovative Strategies, which is PREUS. And there's also the Sexual Risk Avoidance Education funding, all funded via the same organization at the federal level, the Family Youth Services Bureau, which is part of the Administration for Children and Families. So that's where our funding comes from, and we've received this funding since 2011. The intention of this funding is to reduce untimely teen birth rates, HIV, and other STIs. And currently, there are 45 states and 8 U.S. territories that receive state PrEP funds. The funds are allocated based upon a formula grant, and so every state was authorized to receive them if they were interested, but not all states obviously took advantage of this. And it's based on the population, the number of young people aged 10 to 19 as per the U.S. Census. And so we have current authorization through federal fiscal year 19, which for us is through September 30th of 2021, because we are on a 2-year lag. So the current appropriations period that's going through now would fund us past that. And as of now, it looks like we will continue to have funding for a few more years, but we won't know until we receive that award letter, hopefully within the next year or so. Our program is a comprehensive sexual health education program. So we discuss abstinence, contraceptive use, including emergency contraception, barrier methods such as condoms and other IUDs, etc. We also talk about STIs, HIV, and preventions or sexually transmitted infections and HIV. As part of the discussion, we talk about consent a lot, what a healthy relationship looks like, boundaries, negotiation skills, anything that falls into the area of decision making. And we also talk a lot about reproductive health and anatomy, physiology, the basics of how pregnancy occurs, etc. So that's all part of comprehensive sexual health education. For PrEP requirements, our program specifically includes youth curricula, so implementing curricula for young people. We also have training for adults, which includes our Askable Adults workshop and then other training as needed. And then the other piece of the program is adult preparation topics. So there are about 6 adult preparation topics at the federal, on the federal list that we were to choose from, and healthy life skills, employment education, healthy relationships, etc. are all part of those. So those are all offered in addition to these curricula. And so you may know that there's a newly passed House Bill 19-1032, and this requires that if education on sexual health is provided in Colorado, that it be comprehensive, medically accurate, include abstinence and contraception, education, etc. And that our program is in alignment with that funding. And so while the funding is distinctive because House Bill 1032 also provides some funding from the general funds to offer to counties and to schools. To offer to schools. House Bill 1032's funding is totally separate from our funding, which is federal funding. So the good thing is that the curricula that we have been utilizing and that we will continue to utilize all aligns with the new health standards. And it is also trauma-informed and inclusive, and adapted to make sure that we are meeting the needs of young people who are experiencing out-of-home care or homelessness, or youth who are at risk of trafficking or are survivors of trafficking. So we definitely align with all of that. Just recently, as you may know from the memo sent out by our division director, Minim Castillo-Cohen, COSHI was initially a program with the Office of Economic Security from 2011 to 2019, and then just this month we've transitioned to the Office of Children, Youth, and Families, which for all of you that are existing grantees doesn't really mean any changes other than you will continue to fund through or go through CFMS. I believe that if there is a funding or a code change with anything, one of our grant accountants will let us know, and we'll let you know as soon as we know that, but I believe it will all stay the same. The program currently being offered in existing counties will continue. It just gives us an opportunity to have additional partnerships with youth serving programs within the Office of Children, Youth, and Families, to partner with the Domestic Violence Program and some other programs that we had tried to partner with before, but this will give us a little bit better situation for doing that. And we'll continue to partner with our Colorado Works program because we do meet that TANF purpose area number 3 of preventing children born out of wedlock. So we'll continue doing all the same work that we're doing. We're just going to be expanding and moving forward, able to partner with even more folks.
All right, so as Zoa had mentioned, our program is comprehensive, and to kind of illustrate that, we wanted to share some of the data. These 2 infographics are actually from Garfield County. So as you can see, our grantees are very creative in how they share the outcomes of the program, which is pretty awesome. Comprehensive sex ed oftentimes leads to a decrease in a number of partners that a person has, sexual partners, an increase in likelihood to use a barrier method or other contraceptive options, so things like condoms, dental dams, internal, external condoms, as well as a delay in initial onset to sexual behavior. So as you can see on the left, we have Basalt Middle School, and just for example, if you look here at the bottom in the turquoise bubble, 71.3% of students are much less likely to have sexual intercourse. So all of these outcomes from our counties are consistent with we're having some technical difficulties. All of our outcomes in these infographics are consistent with national data of outcomes of comprehensive sex ed, which is awesome. And then on the right side, the RE2 Sexual Health Education Report. So this is from the year, but they served 1,151 students, which is huge. And just a little background, in Garfield County specifically, we'll talk about the different counties briefly. They are primarily in school districts. So with the new mini grant opportunities and moving forward, we are going to be really focusing on youth and out-of-home care, because House Bill 19-1032 is providing incentive and funding for schools. So we're trying to work with CDPHE and kind of maximize our reach for youth in the state of Colorado. And then this next slide is just continued data. Garfield County is particularly good at using infographics, and it's a really great way to just share information back with the school districts. Oftentimes, Garfield County, they work really hard at working with the schools, and then once they're in there, they train the health professionals or a teacher within the school district to actually implement the curricula, and then all of that data that they collect, because we do collect pre and post data for our federal grant requirements, they can then share that back to show how it's working and kind of keep the principals and administrators involved with kind of what's happening. All right, and then just this last one, just a couple more infographics on the left-hand side. This is Denver County. So as I said, we're going to be talking about the different sites Denver County was funded until this past year, so there's no longer funding there, but when there was, Denver County really focused on implementing curricula to youth and out-of-home care. So some of the group homes, there's one in particular for human trafficking survivors, and Denver was originally, the funding was housed at the Family Crisis Center. So a lot of the youth that were touched by that program were youth in out-of-home care, youth experiencing homeless, etc. And although oftentimes youth in out-of-home care are either, oftentimes they're more sexually active than youth that are not in out-of-home care. And so it's really important to get that information and provide them with resources, where to get tested, condoms, etc. And then on the right, it just shows Colorado PrEP overall. I want to take a step back. You've been hearing Zoe and I say Colorado PrEP and COSHI. Our program was known as PrEP, the Personal Responsibility Education Program, which is our federal funding stream, as we had discussed. However, in Colorado, there are a lot of different PrEP acronyms. There's a school that's called Strive PrEP. There's the pre-exposure prophylaxis, which is an oral pill taken to decrease a person's risk for contracting HIV. And there was a lot of confusion overall. So we rebranded a couple of years back to COSHI. As you can see, this is using PrEP. It's the same thing. We just are really trying to clear up any confusion moving forward. So we serve approximately 2,000 youth each year, which is awesome. Like I said, a large portion of that comes from our Garfield County participants. And this just really aligns with CompSec in general. As you can see below, after PrEP, decreases intentions to have sex and increases in intentions to use condoms and other barrier methods. All right, so the youth curricula component of the program. All curricula is evidence-based, medically accurate, age-appropriate, inclusive, and culturally sensitive. All of the curricula that we use in Colorado has been chosen or selected from a federal list of approved curricula from FSBE. And a few of our curricula have been further modified to be more trauma-informed, just to add that extra layer. A lot of it has to do with language and modifying things such as condom demonstrations to really keep in mind those youth in the room that may have past trauma. And the curricula that's utilized: Power Through Choices, Making Proud Choices, Be Proud, Be Responsible, Street Smart, and Draw the Line, Respect the Line. Each curricula is slightly different. For example, Draw the Line, Respect the Line is for younger youth, oftentimes 6th, 7th, and 8th graders. Street Smart is designed for homeless youth, and it's a psychosocial approach to risky behaviors. Be Proud, Be Responsible is primarily for youth in a classroom setting. Making Proud Choices is also more of a classroom setting. It's made by the same group of people. And then Power Through Choices is our newest curricula that we just added. It's the only curricula that was designed specifically for youth in systems of care. And we will touch on Power Through Choices in just a bit as well. And then the adult training component. So our adult training is called Beyond the Birds and the Bees, Becoming a Truly Trusted Adult. This was created to bridge a gap between the youth curricula that was being implemented and then the professionals that interface with the youth. So we oftentimes notice, especially at the Family Crisis Center, we would go in and teach classes for youth or curricula to youth, and then those same youth would go up onto the milieu and ask follow-up questions to the milieu staff. Maybe just clarification or whatever it might be, and oftentimes those staff felt extremely underprepared for the questions that they were going to be asked, and we weren't setting them up for success. So this training was created because of that. It's a 2-hour training. It covers the state laws in Colorado relating to sexual health. There's a values clarification activity, and then at the end, we offer time for professionals to practice answering tough questions. This training was created, like I said, for caseworkers, JLs, CASA workers, teachers, milieu staff, foster parents, kinship providers, and any other professional that interfaces with youth to just help them feel more confident, either having conversations or providing resources if maybe they're not quite ready yet. And then on the right, you can see just an information sheet with Zoe and I's email about the training. And then, as I said, there are 2 current COSHI sites. So we have Huerfano County at the top. It's based at the Sangre de Cristo Center for Youth. And the programming in Huerfano County is implemented at schools and community-based organizations. So they do a lot of like immersion trips, if you will. So the top left, they go on camping trips. They go to the lake in the summer. They do all sorts of really cool stuff. And then on the right, this is a group, they do a soccer program, and Huerfano County is pretty amazing. They are able to engage almost the whole community of youth in Huerfano County, which is pretty incredible. They had one of the highest teen birth rates before COSHI came there, and since the program, and so correct me if I'm wrong, they have not had any untimely teen pregnancies with the COSHI program, which is awesome. And then below, Garfield County, it's based at the Family Visitor Program, and the programming, as I said before, is implemented in school districts. And then down here, Garfield County, their kind of unique aspect is they do a really awesome teen internship program, and as well as a lot of community events. I feel like every time we talk to Diana, the program manager in Garfield County, she's going to meetings with administrators. They're going to the Strawberry Festival and all sorts of cool stuff to engage their community.
Great. So now that you know a little bit about our program, let's talk more about the counties and the mini grant opportunities that are available to counties. So we are refocusing a bit and offering funding to new counties who are interested in providing comprehensive sexual health education programming in their communities. We'll continue to fund the existing 2 counties over the next 2 years as well. But in addition, we are offering up to $20,000 in mini grants each grant year for the federal fiscal year. So we have a little bit of funds still left for this year, although it's late in the year, and so it'd be definitely pushing through some paperwork quickly to get funding to go out, and it would maybe not be at the full funding level of $20,000. It would be based on what the county needs and can implement within the next few months, since we are on the federal fiscal year of October through September. So our grant year ends technically September 30th of this year, and we'll start again on October 1st. If we have quite a few interested counties, then priority will be placed on counties who have higher teen birth rates and who are able to begin implementation sooner. So we'll kind of focus our efforts in on those counties who are ready, and want to have staff trained right away, and it'll be on a rolling basis. So there's not really a deadline. There isn't a date to apply by. It's once you think your county's ready and you're interested, you would contact us or fill out the interest form online, and it's on our the Colorado Department of Human Services website under the Sexual Health Initiative, or COSHI, which I believe is under the Children and Families section of the website. And the link is there. This PowerPoint will be sent out afterwards, so you'll have that as well. Once folks fill out the interest form, then we will reach out to the county to discuss the funding, what the requirements are, etc. These will be issued via purchase orders that will allow the county to bill for reimbursement of costs via the Colorado Financial Management System, which is CFMS. And counties will be asked to participate in our data collection, so having a pre and a post survey for young people who participate in the curriculum, and then also completing short reports in the middle of the year and at the end of the year, so that we can turn those into our federal funders. So this mini grant application the county can then decide to sub-award those funds or work with a community-based organization to get those funds out to the community. It will really depend on each county and how they approach this. So here's the basic steps. You would, after you fill out the interest form, we would, set up a meeting to talk with yourself and the person who filled out the interest form, and hopefully someone from maybe accounting or the financial systems at your county, and folks who would be able to do some decision making on the process and what the expectations are so that everyone's on the same page. That can be a virtual meeting or a phone meeting, or we're happy to travel to counties to come meet in person as well. Then Anna would work with the county to identify what curricula would be appropriate for that county or for the community-based organization that's actually doing the implementation, and sort of a plan of action that would include the target audience, where the curricula is being implemented, how we're recruiting young people, and just kind of put that all together into what we call our proposed implementation plan. And there's also a draft budget that will be attached to this email and PowerPoint so that you know exactly what that looks like. So the implementation plan is just a couple pages. It talks a little bit about what your plan is to offer services to young people in the county and how you use the funding, and that should correlate with the draft budget. And Anna and I are at your disposal to help kind of identify what typical needs are for program implementation. Will that include incentives? What types of incentives are appropriate, and whatnot. From there, we would have the staff trained to facilitate the chosen curricula. So Power Through Choices, we have a training coming up that we'll talk about a little bit later. But if that's not a curricula chosen and it's a different curricula, then we would work with you and maybe the other counties that are interested in the same curricula to identify a training location. And depending on the curricula, Anna and myself, or one of our other current grantees if they're interested, or someone from one of our partner agencies, either here or back east where a lot of the training and curriculum developers are, will host the training and ensure that the staff are trained. Most of our curricula require 2 staff to implement, so having 2 to 3 staff trained is ideal. Most are also a 2 to 3 day training, so that's also the piece that factoring in travel expenses, etc., would be important for that training. From there, in step number 5, the county staff or the folks implementing would work with Anna and myself to host a 2-hour workshop, the Beyond the Birds and the Bees, Becoming a Truly Trusted Adult workshop. That is so that, I think, as Anna mentioned, the staff are prepared to answer the questions that the young people might have after participating in the curricula. So we want to prepare the staff in advance. Then you would prepare for the implementation, making sure you have all your supplies. There are some supplies that we're putting together kits for counties to have so that they don't have to expend their funds in purchasing demonstrators and condoms and some of the other materials that we can buy sort of in bulk and provide to each of the counties implementing based upon their curriculum and what they need. We want to make sure that the pre and post survey process is set up with our evaluators, so that can be an online link that you send out to the young people and they complete on devices or phones or iPads, etc., or we can do a paper process as well. So there's a lot of different things to set up in those areas before you begin implementation, which would include the collection of pre and post surveys, fidelity forms. And then once kind of you're in that process, invoicing will be done in a way that you send a reimbursement form to me, draw down the funds through the Colorado Financial Management System. It should be fairly easy. And then if you are subawarding or contracting with another agency, then you would then, work with them to ensure their costs are reimbursed, etc.
And it looks like we do have a question. So it says, is this available to apply for by a nonprofit or just county?
At this time, we unfortunately are working primarily with counties because of the financial constraints in the system that we have to work with. At some point, we might look into doing an RFP process for nonprofits to participate, but at this time we're not really going that route because for us, it's more about engaging our county human service agencies to ensure that they're able to offer this curricula, and then they can then work with the nonprofits and the community-based organizations in their area. So I would suggest, if you were interested and you were part of a nonprofit, finding out if your county human service agency, Department of Human Services or Department of Social Services, would be interested in receiving funding, and then we can connect those dots and kind of work together. That's what we've done in Larimer County and some other counties. We started working with the nonprofits initially and got the county on board, and it has worked pretty well. So, does that answer? If that doesn't answer your question, please feel free to send another question. All right. Next, we're going to talk a little bit about budget. So as I mentioned, the funding would be up to $20,000 to be awarded annually. So it has to fit within those grant years, like within the grant year of October 1 through September 30th. Now, if you're not starting services until, July, then that's going to be, the funding is going to look a little differently. So it will depend on what time the application is sent in and how much of the grant year is left, etc. The funds can be used to support COSHI curricula, so training time for staff, staff time for facilitating curricula, purchasing incentives for young people. It's a $50 per youth limit that the federal grant allows. So if you have a young person who completes 75% of the curricula, then they would be eligible for that. You could also do smaller incentives at the beginning and the end, or beginning, middle, and the end. There's lots of ways to set those up depending on what your young people would work best to incentivize them to attend. The materials for classes could be part of those funds. Flip charts, markers, there's a lot of different materials that are included in a lot of our curricula since they are so interactive. Then there's also travel, so staff time or mileage for getting to and from curricula classes, mileage for travel related to COSHI. There's also some counties who have offered bus passes or bus tickets to young people so that they can attend classes and have their travel compensated. And if we usually have like a yearly summit where we all come together to talk about the programming and have guest speakers, etc., sort of a mini conference of sorts. And that probably would be in October of this year, in the next few months we'll be looking at planning that. So travel for that would also be included. And, we can definitely include other things if it makes sense and if it's allocable and allowable by the grant. So we do have a few expectations of counties that are receiving funding. So we expect that they'll implement the curricula to fidelity, and that includes getting staff trained and adhering to the 2-person implementation rules, etc. And this is because it's a federal curricula that's evidence-based, and so because of that, we have to abide by those rules as well to maintain our funding. Collection of data is required. We have some federal requirements, as well as we have added a few questions of our own to the pre and post surveys. So all of those pieces will be required, as well as one mid-year report and one end-of-year report. So we try not to make the reporting too cumbersome. It's really an account of the activities and accomplishments, challenges, and then numbers of youth served. That, in addition to the pre and post survey data, is really all that we need for our reporting pieces. So Anna's going to tell you a little bit about Power Through Choices now, which is our newest curricula that we are really excited about.
Thank you. So as I had mentioned, Power Through Choices is one of our evidence-based curricula that we recently added. Zoa, myself, and a couple others have gone through the initial training of facilitators back in April, and the training was done by Healthy Teen Network, which is based out of Baltimore. They do a lot of work with youth sexual health on a national level. As we had mentioned, it is basically the only curriculum that's designed for youth in care. There are some other curriculums available. Like I said, Street Smart is for homeless youth, but this really focuses on the experiences that youth in care have that kind of makes them, I don't want to say different, but that are unique for those individuals. So 10 lessons, 90 minutes each. It is ideal for 8 to 20 participants, and it does require 2 facilitators. On the right-hand side, it's just a little bit more information, kind of the different, if you look at the bottom, the 1 through 10, it actually kind of plans out what each lesson has in it. And yeah. All right, that wasn't a very good explanation. Okay, so this is just a handout from Power Through Choices, and it just talks about the different aspects of the curriculum that why it works for youth in care and what kind of sets it apart from other curricula that are available. So much like other CompSec said, the 3 significant findings for teens 17 to 19, lower sexual activity and pregnancy rates, less likely to have sex without effective protection, and less likely to be involved in a pregnancy. And I can add these as attachments in the email that we send out at the end. So, as I mentioned, in August, in a few short weeks, we will be hosting a second Power Through Choices training. So, we will be hosting a Power Through Choices training of facilitators. One thing that maybe we didn't explain very clearly is the process in which a county gets trained. They will attend a 2 to 3 day training depending on what curricula they choose to implement in their county. And that would allow those staff to be trained as facilitators. So those 2 facilitators will be able to run the groups where you implement the curricula to youth. And then after that, if counties are really interested in capacity building, at that later date, they might be trained as trainers, and they would then have the ability to host their own training of facilitators to other staff in their county. So this is just an initial training where these folks would walk away and have the ability to implement curricula to youth. So the dates are Monday, August 5th to Wednesday, August 7th, about 8:30 to 4:30. It'll get over around 2:30 on Wednesday, and it's going to be downtown at the Warwick Hotel. So as I said, we're flying those 2 folks out, so Denver seemed to be the easiest place for them to get to us. Participation and attendance is mandatory for all 3 days. It's really important that the people that attend are going to be the folks that are going to be implementing the curricula to youth. It's skill building, an opportunity to do some teach backs where those folks will have a day or a session to practice implementing the curriculum. As we said before, most curricula, but especially Power Through Choices, 2 trained facilitators is a requirement, and COSHI will be covering the costs associated with the training. So lodging may be provided for participants traveling from outside of the Denver metro area. We do have a room block set aside for folks coming from out of town, from further away. And then participants and counties that receive COSHI funding or interested in COSHI funding may be reimbursed for the meals and mileage. So as we said, we're covering the cost of the training and the lodging. So if maybe you are interested and not quite sure kind of what it's all about, if you're willing to send 2 staff, mileage and meals are the only thing that will not be covered. However, if you do choose to receive funding and move forward, those can be reimbursed. All right, so at this time, we've kind of covered everything on our end, and we just want to give you all an opportunity to ask any questions, clarify anything. There's a lot of information, and we just want to make sure you all leave feeling like you have a good grasp on this. Are you going to unmute?
Going to. I don't know how. All right, so if you do have questions, please feel free to type them in the chat box. And in the meantime, I was going to show you a video if I can make it work. So I'm going to try this. You're going to see if it works. If you cannot hear this, please raise your hand and let me know.
Are a grant-funded program intended to prevent teen pregnancy and STIs and HIV using evidence-based curriculum with medically accurate and comprehensive. This initiative really it's important to me because as a really young parent myself, I didn't have any of this information, and I know that without that information, you really can't make the decisions that are healthy for you and your family. And I really just want all young people in Colorado to have access to the same education and information that they deserve. So COSHI partners currently with 3 counties: Denver County, Huerfano County, and Garfield County. COSHI is structured in a way that really allows each county to tailor the programming to meet the needs of the community. And for Denver, that looks like doing a lot of outreach, meeting youth within their community where they're comfortable. A lot of times we'll take youth to lunch and do more informal one-on-one meetings. And it's really awesome to be able to do that and have the flexibility within the structure of the program.
I came from the system, foster care, in and out, since 8 years old. And I think part of my identity was a kid in all of that. And then I was going home to home, FCC to a group home, to trying to be back home. My past 3 or 4 years has really been different. I've left the system. I'm on my own. I'm alone. I'm really independent. I'm in school. I work. When you're in the system, you feel like you're always relying on someone else. And right now, I only have to rely on myself.
Garfield is unique because of the school relationships that they have. Heather worked really hard to get these school staff to trust them, to have superintendents and those key stakeholders be on board, and they did an excellent job, and now they're just part of the framework of the school community in the county. COSHI is shaping the culture of Garfield County in that people are more comfortable discussing sexual health. It is not a taboo topic as much as it once was. This might be the first time that these young people hear this information, and they're getting it from their trusted adults, their teacher that they've known for a long time, a school staff that is a part of their life. So it's a safe space for them. They trust these people. They're getting information they might not otherwise get or that they might get from the internet. If it weren't for COSHI, a majority of the youth that we see would not have access to get to the clinic to get the services that they really need. We actually physically take them into the clinic to get services. And if it wasn't for my staff or anybody down at the youth center willing to take them, they just wouldn't go. It all goes back to having a safe place for the kids and trusted adults that they can actually count on to help them.
I feel like the program has changed their lives. They have more personal responsibility. They have more insight. They know how to take care of themselves. They make better choices. If I had a program like that when I was young, my life would be way different. And I'm proud of them, the youth in our community. They're strong.
The sex ed program in Huerfano County is helping reduce teen pregnancies throughout the area. It basically teaches you to be responsible with yourself and others. So I think the Career Center has on everyone who goes, it has a positive impact on us. We always know that someone's there for us.
Creative, responsible, educated women. Some of the outcomes within Denver County after the implementation of the curriculum have been increased intention to use birth control, decreasing number of partners, delayed onset of sexual encounters, and increase in knowledge of sexual health-related content overall. Although COSHI is currently only in 3 counties, we're really working to expand our network and reaching out to neighboring counties. Denver County works with Jefferson County Human Services in their CHIEPY program. We implement Street Smart to foster care youth that are aging out of the system and working on independence. And we're really trying to hone in on that aspect of the program and really reach out to counties that want sexual health, maybe don't have it, primarily with agencies that work with youth and systems of care. And that might look a little bit different in each county, but that's what's so awesome about the COSHI dollar scholars is they can really be transformed and adapted to the needs of each county and the population that they serve. The goal now is to add new counties that don't necessarily have to go through a long RFP process, but can just express interest, and then they would work with the existing counties and with the state to learn what are the best curriculum for their county, to identify that, to get trained in the curriculum, and then to implement some really great programming in their county.
So that's just a quick video. Are there any other questions on the grant opportunities or next steps or anything else? All right, great. Well, thank you all for attending. If you have other questions, please feel free to let us know. We will be sending out the slides and all the attachments we discussed later today, and you'll receive those. And hopefully, if this all worked correctly, we have recorded this so that folks can watch it at a later date. So if you have anyone else you'd like us to share that with, let us know, and we can send the webinar link once we have it finalized, and we'll also upload it to the website. So thank you all for coming today. We appreciate your time, and have a great week.
Thank you.